Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient with cubital tunnel syndrome is being fitted for a night brace. Which of the following braces would be the most appropriate to help minimize the patient's symptoms? Option 1, elbow brace positioned in 40 degrees of flexion. Option 2, elbow brace positioned in 100 degrees of flexion. Option 3, wrist brace positioned in 20 degrees of extension. Option 4, wrist brace positioned in neutral. Cubital tunnel syndrome is a condition caused by compression or irritation of the ulnar nerve as it passes through the cubital tunnel at the elbow. It commonly leads to numbness, tingling, and weakness in the ring and little fingers. Treatment often involves activity modification, nighttime elbow bracing, and in severe cases, surgical decompression. Let's explore each of the options. Option 1, elbow brace positioned in 40 degrees of flexion. Cubital tunnel syndrome is aggravated by positions of elbow flexion, which stretch and compress the ulnar nerve at the cubital tunnel. A brace that holds the elbow in a slightly flexed position, for example 40 degrees, helps to reduce tension and compression on the ulnar nerve. This is the most appropriate brace for nighttime use as it prevents excessive flexion during sleep. Option 2, elbow brace positioned in 100 degrees of flexion. An elbow brace that is positioned in 100 degrees of flexion would actually increase compression on the ulnar nerve in the cubital tunnel and thereby worsen the patient's symptoms. Option 3, wrist brace positioned in 20 degrees of extension. While wrist bracing is useful for carpal tunnel syndrome, it's not effective for cubital tunnel syndrome, which involves compression of the ulnar nerve at the elbow. Option 4, wrist brace positioned in neutral. Similar to option 3, this brace would only address wrist positioning, which would not help to relieve symptoms of cubital tunnel syndrome. The correct answer is option 1. Let's explore the all-student data. 65% of students selected option 1, elbow brace positioned in 40 degrees of flexion, the correct response. 20% of students selected option 2, elbow brace positioned in 100 degrees of flexion. 5% of students selected option 3, wrist brace positioned in 20 degrees of extension. 10% of students selected option 4, wrist brace positioned in neutral. System classification. This question is a neuromuscular and nervous systems question which represents approximately 24% of all exam items. Content outline classification. This question is an interventions question which represents approximately 29% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out page 60 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builders question and answer video session. See you next week.